Well, the problem is the diagnosis is sometimes uh, not really on time. We would like to see more, uh, to see more patients without uh, damage from the disease. In other words, we would like to see early diagnosis in patients with myeloma. That's one problem. The other problem is the access to technology in order to make sophisticated studies like cytogenetic and molecular. And finally, the access to drugs in this part of the world is not easy because of the cost. So we need more effort, economical support for these kind of patients, especially from our government. Well, we must try to find ways to treat with the best available medicines to our patients, but we must try to convince our health authorities that this an opportunity and it's how you say cost effective, that we must try to do this with our authorities. Health authorities is what we must done, and of course the efforts of private people with money in order to help associations and people who like to help patients with myeloma are also welcome. We need to increase that kind of help officially and privately. Well, the use of bortezomib, thalidomide, and dexamethasone is cheap and easy to administer, and is a good option if we don't have other kind of drugs. So this for bortezomib weekly, thalidomide 100 milligrams per day, and dexamethasone 40 milligrams per week. And we usually support our patient with aspirin and acyclovir in order to prevent zoster, herpes zoster. And we usually recommend 4 months of this kind of therapy, and it's possible at the end of the 4 months. And after we obtain some kind of response, usually we will do, we recommend the autologous transplant. That's the way we think is the cost-effective and cheaper combination. That's what we recommend, highly recommend for patients living in this kind of environment with low resources. Well, it's not very available in Latin America. We're working on it. There are some efforts in Brazil. They're starting to do it. Colombia, Argentina, and Mexico were trying to produce that CAR T cells in-house, or in-house CAR T cells, academic CAR T cells. I think at the end of the year, maybe, we will ready to do it. In fact, our lab already produced CAR T cells. Approval for the government. The Mexican health authorities must approve the use of CAR T cells in daily basis for our patients, and we're waiting for that. We hope that at the end of the year, we will be able to do that. I think the most important issue is try to make some kind of noise. In other words, convince our authorities that we need more money, more efforts, more education in this field, and convince them that this is a cost-effective effort, that we will help patients. We will, in the long time, we will expend less money. We will be more effective in general. Okay, zoledronic acid for the bones, aspirin in order to avoid thrombosis, and also acyclovir in order to avoid herpes zoster. Sometimes we're using some general antibiotics in some patients that we think that are in serious risk of infection. For example, patients with myeloma and low level of neutrophils. We usually recommend other kind of antibiotics in those patients. Good nutrition, exercise, and sometimes psychological support are needed. Congratulate all my colleagues that are working in the myeloma field. It's an exciting field to work now. We have many options like bispecific antibodies, for example, and we must try to make efforts on our part of the side of the street in order to educate more physicians, students, and try to make some, impact in our health authorities to bring more drugs and sophisticated studies for our patients who are not very fluent and who live in this kind of low resources environment. Thank you.